Hi everyone, good morning. My name is Bailani Biusman, and for today's video, I'm going to perform the three difference procedure. First is the starting an intravenous infusion, second, regulating IV flow rate, and lastly, discontinuing IV infusion. The purpose of starting an IV infusion first is to maintain or replace body stores of water, electrolytes, vitamins, proteins, fats, and calories in the client who cannot take an adequate intake in mouth. Second is to restore acid balance, to restore blood components, to administer safe and effective infusion of medication by using appropriate vascular access, and lastly is to establish a lifeline for rapidly needed medication. So here are the materials needed for this procedure. The surgical gloves, IV solution, wet cotton balls and dry cotton balls, IV tubing, cannula et gauge for adult, tourniquet, surgical tape, scissor, gauze pad. So now we are going to proceed the step-by-step process for this procedure. First, check the doctor's order.
To ensure that the client receives the correct IV solution and medication as needed as ordered by the physician. Wash hand. This is to prevent the spread of microorganisms.
Gather all equipment and prepare the IV solution and IV tubing. Check the IV solution, especially the expiration date. So this IV solution will expire on April 5, 2026. And also check the IV tubing as well as, and make sure that the all equipment is updated and not expired.
Maintain aseptic technique when opening sterile package and IV solution. This is to prevent the contamination of IV solution and set which can infect rapidly to the client. Assess IV tubing for canes or vents. Canes or vents in tubing may decrease or stop the flow of IV fluids. Clamp tubing, uncap the spike and insert it into the entry site of the bottles as the manufacturer directs. Then suspend the IV solution and a hook in the preparation area and press the drip chamber and allow it fill at least halfway. Suction effect causes fluid to move into a drip chamber and also prevents air from moving down the tubing. Remove the cap at the end of the tubing, release the clamp and allow the fluids to move through the tubing. Allow fluid to flow until all bubbles have disappeared. Close the clamp and recap the end of the tubing, maintaining sterility of the setup.
Hi ma'am, good morning. I am Bailani Biusman, and for today we are going to give you a IV fluid in your hand to maintain your electrolytes.
Have the client in a supine position in bed. Supine position permits either arm to be used and allows for good body alignment. Suspend the bag or bottle of solution on the IV stand. The fluid height should be 18 to 24 inches above the level of vein. This height is sufficient to overcome the venous pressure. Hand the tourniquet to the doctor or nurse, followed by CB with alcohol and needle. Observe while the nurse is inserting. Anticipating the needs of the doctor is one good characteristic of a nurse. Connect the IV tubing to the needle and start the flow of solution promptly by releasing the clamp on the tubing. Examine the site for signs of infiltration. Because blood will clot readily, the IV flow rate is not maintained. Support the needle with a small piece of gauze pad under the half if necessary to keep the needle in place. The pressure of the wall of the vein does not offer resistance to the movement of the needle. The weight of the tubing is sufficient to pull the needle out of the vein if it is not well anchored, and loop the tubing near site of the entry and anchor it with plaster to prevent pulling of the needle. The smooth structure of the vein does not offer resistance to the movement of the needle. Anchor the arm to an arm board for support if necessary. An arm board protects against change in the position of the VIN and acts as a reminder to the client to minimize arm movement. Adjust the rate of flow according to the doctor's order. The physician prescribed the rate of flow. And complete the level and tape to the IV fluid bottle. Do aftercare of the equipment and wash your hands. This is to prevent the spread of microorganisms. Document the procedure and the client response. Chart the time, site, device use, solution, and rate of flow, and the physician or nurse who inserted the needle. This is to provide accurate documentation and ensure continuity of care. Lastly, monitor periodically at least 30 minutes to check flow rate and observe the infiltration and others untoward symptoms. This documents the client's response to the infusion.
So now let's proceed to the second procedure, which is deregulating IV fluid. So here are the materials needed for this procedure: watch with second hand, tape, label, and calculator.
Review accuracy and completeness of physician's order in client medical record for client name and correct solutions, type, volume, additives, rates, and duration of IV therapy. Follow 10 rights of drug administration to ensure that the correct IV fluid is administered.
Hi ma'am, good morning. I am Bailani Biusman, your student nurse for today. So ma'am, do not lean your hand with your IV because it affects the flow rate of your IV solution, and also do not carry any heavy things. Okay ma'am? Thank you.
Wash hand to deter the spread of microorganisms.
Hi ma'am, good morning. How are you today? I am Bailani Biusman, your student nurse for today. May I know your name ma'am? Date of birth? Okay ma'am, thank you. Ma'am, may I see your hand? I'm going to inspect if there are any signs of swelling, redness. Okay, you are good, ma'am.
Observation or reports of any IV-related complications indicate need to re-establish patient's IV access. IV line must be free of kinks, knots, and clots for fluid to infuse at proper rate. Identify client risk for fluid and electrolytes imbalance given type of IV fluid. It helps to prioritize assessment. Volume control needs to be strict. And then calculate the flow rate. Use mathematical calculations to obtain correct rates.
And now I will be checking the packaging of IV tubing, and it says here that the drip factors is 60 drops per minute.
Count the drops per minute in the drip chamber. Hold the watch beside the chamber. Holding the watch next to the drip chambers allows the eyes to focus on drops and the second hand on the watch to provide an accurate count. Adjust the IV clamps as needed and recount the drops per minute. This is to regulate the flow rate into the drip chamber. Record the rate of infusion in the drops per minute or millimeters per hour in nurse's notes or on parenteral administration's form according to agency policy, and change of shift or when leaving on break, report rate of the volume left in the infusion to nurse in charge or next nurse assigned to the care for client.
So, here are the materials for the last procedure: dry cotton balls, wet cotton balls, IV ticket, plaster, surgical gloves, and empty box for receptacle. So, the first procedure is the check the doctor's order for discontinuing IV fluid and make an IV label.
Wash hand to deter the spread of microorganisms.
Hi ma'am, good morning. How are you today? I am Bailani Biusman, your student nurse for today. May I know your name, ma'am? Date of birth? Now I am here to discontinuing your IV therapy because the doctors prescribed that the amount of your IV fluid is already done. So, are you ready, ma'am? So, let's start.
Don gloves and clamp the infusion tubing. Clamping the tubing prevent the fluid from flowing out of the needle on the client bed. Release anchorage of arm, tubing, and needle. Loosen the tape at the venipuncture site while holding the needle firmly and applying countertraction to the skin. Movement of the needle can be injured the vein and cause discomfort to the client. Countertraction present pulling the skin that causes discomfort. Hold the swab above the venipuncture site. Withdraw the needle quickly by pulling it out along the line of the vein. Pulling out in line with the vein prevents injury at the vein. Immediately apply firm pressure to the site using the swab for 2 to 3 minutes. Pressure helps to stop the bleeding and prevents injury at the vein. Check the needle or catheter to make sure it is intact. Report a broken needle or catheter to the nurse in charge immediately. If broken piece can be palpated, apply a tourniquet above the insertion site. If a piece of needle remains in the client vein, it could move centrally toward to the heart or lung and causes serious problem. Application of tourniquet decreases the possibility of the piece moving until the physician is notified. Apply dry cotton balls to cover IV site. The dressing continues the pressure and covers the open area in the skin, preventing infection. Then discard used supplies of appropriately remove gloves and wash hands. The dressing continues the pressure and covers the open area in the skin, preventing infection. Record the amount of fluid infused on the input and output record sheet and on the chart if necessary. Include the type of solution used, time, and reason for discontinuing the infusion and the client response. This is to ensure accurate documentation of the client's response.